Hi, everyone. Good morning. I'm Dr. Miriam Smith, the host for Empower New Nurses. I'm excited again today because I'm here to share with you some of the tips, to share with you some of the content in this book, Nurse, the Guide to Empower New Nurses in the Delivery of High Quality Care to All Patients. And so, in chapter 4, the fear roller coaster. I'm going to read this for you because I've written it, but I want to read it. I'm saying nursing is a profession of service, both in ordinary and extraordinary situations. Even in ordinary circumstances, fear is a natural emotion to have when you're in a new environment, a strange environment. And here are some of the fears that a young nurse might encounter. Not everyone, but might encounter. Fear of the unknown. They might ask questions like, what should I expect? What type of reception will I receive in this new facility? They might experience fear of making a medication error. They ask themselves questions like, do I know this enough? Well, do I know all the rights of administering the medication? Am I able to? Can I do this? Fear of lawsuits. Lawsuits might come in the head. Am I going to lose my job? If something goes wrong? Fear of speaking to the doctors. The doctors are there a long time, and some of the doctors might be very, they talk a certain way to some nurses, and they might just be scared, or they say the authority in the area, they might just feel intimidated. Fear of delegating tasks. As a new nurse, you go through orientation, but there comes a time you have to delegate. You have to delegate, you have to give the assignment to this one, that one, and so forth. And especially if you were like a PCT or a PCA before you became a nurse, and you might have to be in the same unit where you were in that capacity. I think that can be intimidating, that can be challenging, because not everybody accepts you in a different role. Fear of not being accepted, yes. You're wondering what colleagues are saying. Fear of what my preceptor might think of me. Yeah. Fear of being bullied by senior nurses. Senior nurses, some of them sometimes don't remember that they were young nurses too. But they have to be reminded of that, right? So fear of resolving conflicts, because listen, conflicts are inevitable. That's life. But how we deal with them, very important. And sometimes situations going to arise. You didn't anticipate that, but it happens. But you have to find ways and know ways of addressing them. So in my book, I also have given some suggestions of how to deal with some of the fear factors, how you can acknowledge them, acknowledge the triggers, of course, get counsel and spiritual support. I'm just naming a few on page 39 of my book. Embrace, develop mechanisms such as deep breathing exercises. Be determined to think of your strength and your past achievement. So you are reminded, be patient with yourself, since conquering fears will take some time and persistence. Remind yourself that the exposure and challenges will definitely contribute to your growth in your nursing journey. So celebrate your accomplishment or your wins. So it's also important then to make sure that let me say, it's normal to be fearful at times in a new environment and all of that, but don't let that determine your outcome. Final, you know your dream, so you're going to work on it and follow the suggestions that are in this book and suggestion of others that they have used to cope when they were faced with such circumstance. All right, so my best wish for you as nurses and how you can conquer, or how you can cope with, or how you can deal with, or the solutions you have to help you deal with or navigate through some of those fears that you will encounter and that you have encountered. Thank you for listening. I'm Dr. Miriam Smith, the host for Empowering New Nurses. I just need you to make a helpful comment, subscribe, encourage others on this platform, and continue to grow in this noble profession. Thank you. Bye.